lecture I wanted to give you. So we're going to try to do a little deeper dive into how I think about nerve conditions and hopefully give you guys some clarity. I'm not sure how long this video will be, but we'll get through it as best we can. So if we open up this PowerPoint here, first thing I want to do is talk to you about cervical radiculopathy. You know, when Dr. Bott and Villanueva and I are talking about this in class and how to differentially diagnose nerve-related issues, the big thing we think about first is like, where is it coming from? And it's easiest to start proximal and work your way distal. Okay, so what is cervical radiculopathy? This is something you'll go over very much more in depth in MSK3, which is going to be your spine section. So you go over cervical, thoracic, and then lumbosacral conditions and pelvic conditions in that section. So we're jumping a little ahead here on purpose to give you some background knowledge into how to differentially diagnose down the chain. Again, the nerve stuff has been the stuff that you guys as a class have had the most trouble with. So in preparation for your final exam, I want to make sure you freaking nail it, okay? Because once you understand these concepts better, you'll do really well. So the first things I want to just point out here is that you have 8 cervical nerves, and we call them nerve roots, right? Some people call them roots, some people call them ruts, right? But nerve roots that come out, and T1 is associated with this. And this collectively makes up the cervical and or brachial plexus, right? So we think of the brachial plexus as the nerves that branch off from C5 all the way to T1. And those are the nerves that come together to form the nerves that go down your arm and then all the way down and branch to your hands and your fingers and give you motor control and sensation from everything from your deltoid all the way down to your hand, okay? C4, C3, C2, C1, think to your myotomes. Those help with neck function as well as shrugging and things like that, okay? But we're talking primarily now about C5, 6, 7, 8, and T1 as your cervical radiculopathy kind of cases here, okay? So what I want to point out is that each of these nerves has an exit point, right? Where it exits the spinal canal through this foramen and exits down and then where it needs to go. If you have encroachment of a nerve in this space, could be due to arthritis from bone growth, could be due to a ligament sprain and now you have swelling in the area, could be due most commonly here to a disc herniation, right? You guys have heard of that, where some of the disc protrudes out and encroaches and engages that nerve. Anything down the chain from that nerve root, anything that nerve root innervates, you may have symptoms that lead down that chain. So if we can understand the nerve root concept, then we can work down the chain and try to delineate if something's coming from the nerve root, or it's coming from the brachial plexus, or it's coming from the peripheral nerve down the chain. Okay, so another way to look at this from more of like a top-down view is you have your disc here. Here's a normal on the left, disc here. You have your spinal cord in the middle. You have the nerve roots coming out of the spinal cord. And then if a nerve, or a disc rather, is herniated, that can encroach on that space and cause compression and irritation. Again, nerves like space. They like to be able to move. If there's something encroaching on their position, they get irritated. All right, next up. Again, we're going to look at C5, 6, 7, 8, and T1. This is the brachial plexus, so this is one layer deeper, right? So if we go back to this, we're looking at the nerve roots here. You can see the nerve roots here, and then you can see how they break off and go down into the arm. They split up. This is complex. This is a big highway of nerves. It's really hard to understand. So what we're going to do, and I want you to do, is get out a piece of paper, and you're going to start to draw this, and not this particularly, but I'm going to teach you a way to draw this. And that's going to help you understand the nerve roots better, and then also how the nerve roots innervate down all the way to the peripheral nerve at the end. Okay, so What I'd like you to do is get out a piece of paper, and what you're going to do is write on the side, you're going to write C5, C6, C7, C8, and T1. And on the top, you're going to write roots, trunks, divisions, chords, and branches. All right, if we go back one slide, we're going to end up trying to draw something that looks kind of like this. And this looks really odd and kind of confusing right now. But this is a simple diagram of this. Okay? If you can draw it out and you know how to draw the brachial plexus, then you'll know what nerve roots innervate what. And that will give you a little better understanding of peripheral nerves. Okay. So what I'm going to do is exit this PowerPoint. And so we're going to start to try to draw this. Okay. So the first thing I want you to do, and forgive me because I'm drawing this on the screen and I think this is going to go just fine, but you're going to go C5, C6, you're going to draw a triangle here, right? C5, C6 to the delineation of roots and trunks. Then you're going to take the point of that line, you're just going to draw a straight line all the way across. Very good. C7, this one's easy. You just draw a line all the way across. C8 and T1, you do the same thing you did for C5 and C6. You do a little triangle or an arrow or whatever, and then you draw a line all the way across. That's where you guys should be right now. If you're not, I'll give you a second for your page to look like this. Next, under the divisions heading, between C6 and C7, you're going to draw an X. Okay, very good. Then right below that, you're going to draw a right to left diagonal line down to the C8T1 line that looks like this. Let's try that again. Let's do it like perfect. Okay, sticking with me. Now, under chords, you're going to take this top line and you're going to draw a little loopy line down under C7, C8, and end right there. Likewise, C8T1 line here, you're going to draw a line up that intersects and creates kind of an arrow with that other line. Good. If we go back to the chord section, you're going to draw a line that extends from here all the way up like this. So what you should now see is 5, 1, 2, 3, 4, 5 end lines. This one has 2 coming together. We count that as 1. And how I want you to think about this is there's an acronym that we use called MARMU. MAR, M-A-R-M-U. These are the peripheral nerves that eventually branch off and create your musculocutaneous nerve, your axillary nerve, your radial nerve, your median nerve, and your ulnar nerve. But let's do a little bit more. I'm going to change my pen color here. We'll change it to red. There are some other peripheral nerves that don't end in the hand down here. Like some of this is obviously this is the armpit area, right? But all these end these especially end in the hand, and this one ends more in the antecubital fossa area. So if we go back to here, let's draw some lines here. So go back to C5 nerve root. You're going to draw a line off of that, just up like that. Then from C5, C6, C7, you're going to draw a line that intersects with all of them. And then you're going to connect them to that line. So we go connection here, connection here, connection here. We'll get to what these are. These are all peripheral nerves that branch off of these nerve roots as well. Okay? In the trunks division, you're going to draw a line like this. That's another nerve. And then I draw a line that looks like this. In your chords division, you're going to draw a line that goes straight up. Then this next one, you're going to draw a line that goes down, up, down. And then in the bottom line here, you can draw 3 lines that go down. 1, 2, 3. And guys, this is all the peripheral nerves that branch off of this part of the brachial plexus. So how do we know what these nerves are as well? Well, let's get into it. I'll get back to my presentation to help you guys think through this. So that's where you start. Your page should look like that. If we think about what's the musculocutaneous nerve and how you get there, musculocutaneous nerve is innervated by the nerve roots of C5, C6, C7, and this is what that looks like. One thing in the divisions category, if you go back to that original, here we go, brachial plexus picture, in the divisions, there's some nerves that start to branch more anteriorly and some that branch more posteriorly. And so the one thing that we don't get a good picture of in this model that you're drawing is this division of anterior-posterior. So I'm hoping that my highlights will help kind of clarify that. All right. So the musculocutaneous nerve, C5, C6, C7. If we move on down the chain, you get your axillary nerve. Axillary is more posterior, right? So you can see it diving deeper to this branch, the anterior division. The posterior division dives deeper. C5, C6, all the way out to the axillary nerve, innervated by C5, C6. Next up, we think about the radial nerve. This encompasses all of them, C5, C6, C7, C8, T1. But it all goes down eventually into the posterior direction. Right? Think about where the radial nerve is in the upper arm. It's in the radial groove of the humerus, and then branches down the posterolateral elbow all the way down to the back of the thumb. So this is more of a posterior base nerve. We go to the median nerve. Median nerve is innervated by C6, C7, C8, and T1, and this is how that branches off. And then finally, the ulnar nerve, which is the easiest for nerve root reasons, is going to be C8, T1. It's just the last two, right? So if we take that and we erase all the colors, right? Here's all the colors that help you distinguish those nerves. And if we get rid of those colors, now let's start filling in the red peripheral nerves. So we already know where our endpoints are, the musculocutaneous, axillary, radial, median, ulnar, the marmu, if you will. So if we start up here at the top left at C5, first we have the dorsal scapular nerve. If that nerve is unfamiliar to you and what it innervates, meaning what muscle that it helps send a signal to, or a group of muscles, you should look it up. I'm not going to go over the muscles that they innervate because that's a good opportunity for you to study, and then study the muscle and study the muscle action, and then some impairments that might be happening if the nerve is affected. Okay, so right under that we have the long thoracic nerve. In the trunks division, the top one is the suprascapular nerve. We've talked about that a lot in class with a suprascapular nerve palsy from like a paralabral cyst. The subclavius nerve. So your subclavius is innervated by a separate nerve. That's this nerve. If we go to the cords section here, this top one's the lateral pectoral nerve. Go down a little bit. We start with the inferior subscapular nerve. If I can spell those right. Sorry, those are misspelled. And then you have the superior subscapular nerve. And then, of course, you also have, some people call this the middle subscapular nerve, but it's also known as the thoracodorsal nerve. And so that's a big one to know what that innervates as well. And then finally, at the bottom here in the cords, you have your medial pectoral nerve. And then you have two nerves that help with sensation in the skin. You have your medial brachial cutaneous nerve, cutaneous meaning skin, and then your medial antebrachial cutaneous nerve. So I just mean upper arm and lower arm skin sensation nerve. Awesome. This is what your brachial plexus charts look like. Here again is just a recap of how complex it actually is. But again, if you can draw this, then you can work your way back to what nerve roots affected. And then somewhere along this chain, if someone's getting numbness and tingling, somewhere along this chain from most proximal nerve roots to most distal branches, that's where the impairment is happening. And so it's your job as a clinician to try to figure out where in that chain it's happening. So we have things to help us figure that out. And just to recap some myotomes and dermatomes, on the left side of the screen you can see the dermatomes, and this is why we go over it. If they're having decreased sensation in these areas, you can correlate that back to a nerve root issue, right? But they could have some decreased sensation in C7, that's carpal tunnel syndrome. So you have to do other things to rule out cervical radiculopathy or rule in carpal tunnel syndrome if you think that's what's going on. So this is where it can get confusing. It's because, the median nerve, if we go back, is going to be innervated by C6, C7, C8, T1. So if we go back here, it's like, well, is the median nerve at the wrist, or is it pronator syndrome, or is it thoracic outlet syndrome, median nerve, or is it nerve root C7? It's like, well, you have to do tests to figure that out, and you guys know tests to figure that out. You just have to break it down. So of course, those are your dermatome patterns, and then you have your myotome patterns. And so this is a good chart, I think, of helping you break down C5, 6, 7, 8, T1 in terms of the testing you would do. So let's say that someone had C7 issue, they had decreased sensation in C7, and then their myotome tests were also limited at C7. Well, if someone has carpal tunnel syndrome, they may have decreased sensation at this C7 area, but what they don't have is triceps weakness, right? Because that's actually innervated by the radial nerve. So you look up the chain, it's like, that sensation is median nerve, and they're strong with the C7 nerve root. So now I'm starting to narrow my focus and go, this is probably not a nerve root issue, this is probably a peripheral nerve issue, and because the nerve root myotome testing is good. And so maybe what I'm actually testing is not the dermatome, it's the actual peripheral nerve that's giving me weird sensation stuff, which is what carpal tunnel would be, right? So then you have other special tests like compression test, valence test, things like that to confirm what you're thinking about the peripheral nerve. I hope that makes sense. It is kind of confusing because a lot's going on, but hopefully I'm clearing this up. If we move on, this is another, artist rendition of the nerves and the nerve patches of the arm. So this is more of a cutaneous nerve situation, but this is how complex it is. This is why you got to know it, okay? So this would be a good time to pause and look through some of this stuff. And how I used to study is I would go through each one. Okay, suprascapular nerve, go through boom, 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 boom. Or supraclavicular nerve rather. Go through and see, do I know what muscles that innervates? Do I know what patch of skin that innervates? And if you don't, you need to dive a little deeper, right, until you really understand it. Here are some ways you can test peripheral nerves as well. This is in your elbow lecture, compressive neuropathy elbow lecture. But you can see that the median nerve travels along a long track. In any of these areas that you see are areas where the median nerve can get impinged. So you have this area right here, right? The ligament of Struthers, there can be an impingement site. You have this, the pronator teres syndrome, right? Which is what this test is showing you, how it can pinch and compress here. Then you also have your carpal tunnel, right? Same thing with pronator syndrome we talked about right here. So these are ways that you can start testing for peripheral nerve issues versus nerve root, myotome, dermatome, reflex issues. Here's looking at the radial nerve. And so that, of course, is going behind the humerus, down the radial tunnel of the humerus, and then out along the back side. And it shows you all these different impingement sites. And here's radial nerve compression sites here, proximal elbow or wrist. And if we move on to the ulnar nerve, again, a couple different compression sites that it has along the way. So we've talked about this throughout the course in our lectures. You have ways to test these things, all right? One of the ones that's not in your special test, I'll just review it here, is just that we call it the elbow flexion test. You just hold a deep position of elbow flexion, and the reason being, if you look at this bottom right picture, you can see the nerve comes down the humerus and wraps around, and that wraparound point around the medial epicondyle can get compressed with that deep elbow flexion and give you symptoms down your hand. Someone with ulnar neuritis from like a hook of hamate fracture shouldn't have a reproduction of symptoms with deep elbow flexion. Does that make sense? So their hand should be fine with elbow movements, shoulder movements, or neck movements. They might have numbness and tingling with, compression to that area. So, good. Here's just another schematic of possible entrapment sites. Of course, you got the neck, you got the brachial plexus, you got around the elbow, you got around the wrist, and you got fingers. So I want you to think about, what does myo mean and what does dermo mean? And those should be pretty obvious to you at this point. Get into this schematic as well. We talked about this a long time ago. I'll try to draw some arrows. I haven't really practiced this, so forgive me. But you have your light bulb, which correlates directly to your muscles. So the light bulb only turns on because there's an electrical signal from somewhere to turn it on. Your muscles only turn on and fire because there's electrical signal from somewhere to turn it on and fire. Make sense? So you can't really see it, but this cord is plugged into the wall. The wall we would consider your central nervous system. So we could call that your spinal cord, brain, spinal cord. That's going to be where it plugs into the wall. Let's just draw an arrow that ends right here. So now you have a signal that goes up and hits the light. Well, what's the nerve root, right? The nerve root is going to be your ability to plug the light into the wall. If there's a problem with where the plug plugs in, then the light won't turn on, right? If there's a problem with your house's electrical wiring, that's your central nervous system, then the light won't turn on. So then you get, what's the cord? The cord is what travels the electricity down. Well, that's going to be your peripheral nerve. Your peripheral nerves are the cords. So if you took some scissors and cut this, well, the brain in the central nervous system works good. It's plugged into the wall. The muscle or the light's working well, but the peripheral nerve is out, is cut. So it's not getting a signal up. So that's what we think about with compressive neuropathy, really, is where is the nerve issue coming from? And so start at the wall and work all the way to the light, and you'll find out where you need to be. One last little picture here. This is why upper limb tension tests put stress through the arm or through the nerve. If you have a nerve root compression here and you do upper limb tension test, it will tug and pull all the way back on that nerve. This is also a way you can kind of try to differentiate brachial plexus or elbow. If their tension, their pain starts coming on, when you extend their elbow and their other side is here, maybe the entrapment site's coming from elbow or up. So it's just a way you can try to differentially diagnose. So I hope this was helpful to you guys. Sorry it was 20 minutes, but I think it's worth the time. Email me with any questions. Thanks.